Hello, Ute here of Ute Hagen YouTube channel, and I am outside sitting on my bench by my woods in the afternoon sun. It's a little bit cold, so I have to keep my gloves on. And I am doing take 2 of this particular post because this is an analysis of the Swedish study from 2011 in which the death records of post-op so-called transsexuals, a group of almost equal males and females, if we're speaking about their natal sex. These people had the surgeries between 1973 and 2003, and they had died, some of them by their own hand, some of them from natural causes. And this study is called the Swedish longitudinal study because it involves decades later. Now, it didn't interview people who were alive, but instead examined the death records. And there was a control group of typical Swedes, matched by age and sex, who had also happened to die, a few of them by their own hands, and they compared various information. I think they found that there was, for example, not significantly more people who were convicted of crimes or something like that. But what was found, which is significant and often not spoken of, is that they found an average 19 times higher rate of suicide among individuals who were post-op transsexuals 10 to 20 years after the surgeries. And that is a significantly higher rate of death by suicide, and that is statistically significant. I don't understand why death records in other countries have not been examined. Now here's the shocker, which I derived from the testimony of Dr. Stephen B. Levine, now posted at the YouTube channel, which is named Thoughts on Things and Stuff, originated by Dr. Jonathan Streeter, who is an expert on cults. So, this testimony of Dr. Stephen B. Levine, a formerly affirming psychiatrist, stated a shocking fact that I had not known from my reading of this study. The natal females in the study, who were individuals with a so-called gender identity of the opposite sex, meaning that they were females identifying as males who had had surgeries to modify their bodies, their death by suicide rate was 40 times higher than the control group of Swedish females who did not have this diagnosis. This is an example of how women are studied together with men, and then the data is averaged. So instead of reporting this shocking 40 times higher suicide rate among You could say, people say, trans men who were post-surgeries 10 to 20 years later, their suicide rate was 40 times higher than your typical person. Now, what does that tell us? Perhaps it tells us that they regretted it all. Perhaps it tells us that these surgeries were not the solution to their psychiatric illness. And it certainly tells us that women, females, girls who have an ideation that they should be a male are possibly in need of better therapy, dialectical therapy, cognitive behavior therapy, movement, like here on my site, movement on my, channel, movement for wellness. I think if you committed suicide, it meant that whatever you did 15 years before did not make you happy. I think this is very important, and I hope you'll click the like. And we're just about almost up to 600 subscribers. I am now part of a Facebook group for between 25 and 30 trans widows. Once again, I'm finding that our stories of narcissistic abuse and financial abuse by our husbands or ex-husbands is pretty similar, follows a pretty similar path. We also are not studied. Trans widows are not studied. There are no sociological studies that have any kind of sample size that anyone would take seriously. Maybe 20 years ago, there was someone who wrote a PhD thesis on 17 of us, and that's just not a significant sample. And I think it included women who stayed or something like this. So please copy this, post it on Twitter where I'm banned. Let your friends who are parents of these rapid onset gender dysphoria girls know that this is what they found in that Swedish study of 10 to 20 years past the time that those decisions were made. Now that you've heard this difficult information, please go to Thoughts on Things and Stuff channel and watch it for yourself at utahagengrasswidow.wordpress.com. I have a transcription. I'm not quite done with it. Dr. Levine made 13 points of the fallacies of so-called affirmative care. This Swedish study proves to us that certainly that so-called affirmative care does not prevent suicides, especially in natal females. Please be well, always in mind and body. Take care and come back.